spite of all the progress that's been made in this country, for me, I feel overall that as a race, even when it comes to healthcare, our value, our worth is still considered under that of white or Caucasian patients.
The conclusion that Dee came to is one that I think many other folks in my clinic who are Black African American also come to. And, I think that just tells us that even though we've come a long way in our country, there's still racism in our healthcare system that needs to be addressed in a systematic way before we can really see better equity in outcomes and patient experiences.
I think it's possible that had I been a Caucasian woman, I think that maybe I could have gotten some of the process started and diagnosis made a lot sooner and treatment started a lot sooner.
Sometimes it's just a patient complaining of back pain and it doesn't get evaluated in a timely way. And then by the time we get a diagnosis, it's quite advanced. One often wonders what happened. Why wasn't this found earlier?
I think there's still a level of suspicion that we might be really trying to access drugs for more like getting high, junkie reasons, more so than what we really want it for, and that's for real identifiable pain.
We often say, well, if there's a problem with your doctor, if there's something you're not happy about, you got to tell us. But what I've heard is that they're afraid of speaking up. They're afraid of being labeled a troublemaker or a problem patient. And I think we as providers need to be aware of that. Be aware that sometimes patients may not be willing to speak up. But I would also say that it's okay to speak up, and you should. I think it's important for patients to be honest with their doctors and their healthcare team if they feel like things aren't being addressed appropriately. I know it's easy for me to say that sitting here as a provider and not as the person sitting in the chair, but I think it's unfortunate when we don't get feedback right away that this is going on. That there are issues in a patient's care. We need to think harder about how we can improve barriers in communication between a patient and provider, because clearly they exist.